Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with the Nassau Community College student Gina Peter. And today we're going to learn about chiropractic care, what it is and how it can help lead you on the path to a better health.
Our guest today is Dr. Todd Sinett, a chiropractor and the founder of True Healthcare. That's True spelled T-R-U. Originally from Long Island, Dr. Todd Sinett is also a pain expert, author of several books, and the inventor of the Backbridge System, which we will learn more about today.
Dr. Sinett, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much for having me. I really appreciate it.
So I hope you're doing well in light of this COVID-19 pandemic. Has the virus affected you personally?
I mean, thankfully not. I mean, obviously it impacts everyone, but, no one in my immediate family had gotten coronavirus, which is obviously quite good. But, it's a terrible thing all around. That's for sure.
Yeah, it is.
I was going to say, it's great to be speaking with Nassau Community College. I've taken a whole bunch of classes at Nassau Community College.
Oh, really?
It's kind of my alma mater.
Oh, nice. So it's mine also.
And I'm currently a student, so I'm here. So for those that don't know, can you tell us what a chiropractor is and who would go to one?
Sure. So a chiropractor, or the definition of chiropractic, is usage of hands or the healing using natural methods or using your hands. And chiropractic is a very good health modality to help people with neck pain, back pain, mid-back pain, lower back pain. And it's something that could be very helpful. It helps with your overall health and keeps your body limber, loose, keeps your posture in balance, and really does everything it can to help people feeling quite good. And I think one of the most important things about chiropractic is it really follows the belief of first do no harm. So it's really the safest treatment method for someone who's looking for help manually.
So tell me, what made you become a chiropractic physician?
Yes, well, I'm actually a second-generation chiropractor. My father was a chiropractor.
Oh, nice.
And I had decided I was going to do everything but become a chiropractor until I was we were on a family vacation in Aruba, and the local pediatrician asked my father to take a look at an 8-year-old boy who was suffering from headaches almost every day. So I went with my father to the hospital to meet up with this kid. And my father treated the boy, and within the first treatment, he was able to relieve the boy of his headaches. And he'd been suffering from headaches for every day for a couple of years. And what happened was the family was so thankful, they showed up the next day at the beach to pay my father for his services. So my father said, I'm not going to take your money. And then the next day they showed back up and they gave him an offer he couldn't refuse, where they cooked for us.
Oh, how nice.
Homemade food. So it was at that point where I knew that the knowledge that my father had and the ability to help and make a difference in this world, I knew that it was something that I guess really became a calling for me. So, I was a major of communications and economics at American University at the time, and then I decided to change my major, become a chiropractor, and I was able to go to Nassau Community College, take a whole bunch of sciences, and became a chiropractor.
So tell me, how does chiropractic medicine differ from a physician, a DO, or other? Right. Tell us about that.
Chiropractic, the length of school is very similar. So chiropractic school is about 4 years. I guess the difference from a medical doctor is the residency program. But we spend a lot of time studying the spine, studying the body, and studying health. So we really are experts in addressing back pain and the spine. And again, our treatments are very much hands-on based. So that's how it would really differ from a medical doctor. A medical doctor, most of their training and approach to it is really from a chemical aspect. So prescribing some medication and or providing medication or injections. An osteopath does have some medical training as well. And they're a little bit, philosophically, they're a little bit of a hybrid between a chiropractor and a medical doctor. So the osteopath is trained in some of the manual therapies, but also can provide medications and do surgeries as well.
So if I'm coming to a chiropractic office, I can expect more of the manipulation of my spine rather than a medical or prescription, if you will, of medication.
Correct. Chiropractors in New York are not licensed to prescribe medication, so you would not have any medication in dealing with a chiropractor.
Okay.
But a chiropractor would take a very natural, physical approach to the patient.
Can you tell us about True Healthcare? Like, what services do you offer? Where are you located? Things like that?
Yes. So I founded my office is called True Whole Care, not True Healthcare. So it's True Whole Care. And it's spelled with a W because I really believe that if we're going to look at all of whole, healthcare really needs to be whole care. And when I say whole, what we're doing is even when we take a look at back pain comes from 3 different sources. So back pain comes from structural sources, such as muscle, bones, discs, and nerves, which is what a typical chiropractor would look at. But back pain also comes from diet and nutrition, which is a pretty amazing factor. So what you eat can upset your digestive system, and then your digestive system is very much linked to your muscular system. And then emotions and stress is actually the number one factor for back pain. So Stanford University ran a very, very large study, and they found that emotional outlook and stress is the number one predictor of who will have back pain and who won't. So I literally built an entire center around that premise of taking a whole look at a person's health. So if you're coming in and just seeing a typical chiropractor, you're only going to receive structural treatments. And I feel that that's very limited because a lot of people could benefit from dietary changes or even medication, and or they could benefit from stress management and relaxation techniques as well. So basically, office, and we can have all different options available for you based on not only what your symptoms are, but really what you need. So I think that's very, very important.
So this is a team approach. It's just not a chiropractor that's in this practice. It's a combination of professionals who are providing care for patients who are coming in.
Yes. So if we find, or if you were to come see me and I determine that it's a structural issue, we have chiropractors, we have physical therapists, we have massage therapists, we have acupuncturists, and if that doesn't work, we also have non-surgical orthopedists. If it is a chemical or digestive problem, we can have you see the nutritionist and or the non-surgical orthopedist for medication and injections. And if we think it's stress-based, we do something called biofeedback and stress management, where we'll literally be able to register a person's level of stress and tension and teach them to respond to their stress and tension differently. So I only believe in the team approach because in any treatment that you may have heard of, it all works. But what we don't do a good job in our society is figuring out where you should be. So our treatment, unfortunately, in our society is based on who you see as what you get and really not what you have or what you need. So if you wind up in a chiropractor's office, they're going to give you a structural treatment. If you wind up in a physical therapist office, they're going to give you exercises. If you go to a primary care doctor, they're going to give you medication. But each of those people could be the answer to your solution, but we don't do a very good job isolating or determining where you should be. So in my office, we're very good at figuring out where you should be and having all the different treatment options in one location.
So this team approach that you have, when you have the health professionals that you named, how does this compare to just going to an orthopedist? Is this approach being that it's manipulation and kind of like a psychotherapy kind of approach? Mm-hmm. Is that more effective than a surgical intervention or medicine?
Yeah, I mean, I think the reason why we have this epidemic of back pain, and we do have an epidemic of back pain, where about 80% of the world's population will suffer from back pain and need treatment. And I honestly believe that the reason why we have so much back pain is it's a philosophical issue where we're approaching back pain improperly. So back pain is currently only looked at as a structural or orthopedic problem. So people only think it's based off a muscle, bone, disc, nerve, and they're taking a third of the information and presenting it as if it's 100% of the information. And that's simply not the case. But like I said earlier, back pain, a third of back pain is a structural issue, a third of back pain is an emotional issue, a third of back pain is a dietary or digestive issue. So if you're just going to a chiropractor and they're just giving you structural care and your problem lies outside of that structural care, you're not going to get very good results. So I do believe in the team approach. So again, if it's structural, first person to see would be a chiropractor, physical therapist, massage therapist. If that doesn't work, a non-surgical orthopedist. And if it is a structural problem, you want to go through all those different levels first before you're seeing the orthopedic surgeon. Because you always want to do the least invasive treatments before you do more invasive. So if we think it's digestive, we try change your diet, see your nutritionist, then see your primary care doctor or even a gastroenterologist. And if it's stress-based, work on some stress management techniques, do some relaxation breathing, do whatever relaxes you, do some stress management or biofeedback, or see a therapist or a counselor, and if need be, see a psychiatrist for some medication. But it's entirely set up for least invasive to most invasive, and it's fully comprehensive because everyone can be of great help. A orthopedic surgeon could be absolutely the answer to your condition. It's just that's not where you want to start.
Mm-hmm.
Yeah. So if someone were to make an appointment, how long would the appointment be? How long would the sessions be? In other words, how many visits and how long would the treatment take for back pain to resolve?
Sure. So, the first visit is about 45 minutes. I would say the visits are on average around 45 minutes. So a patient will be in and out of the office within 45 minutes. The number of treatments is predicated solely on what the person presents with and what we need to do together to do everything we can to be of help to the patient. I personally say that my goal is to see the patient as little as possible, with them seeing the results as long as possible. I also very much like the dental approach, where you're not just waiting for your teeth to fall out or rot. You want to set up periodic checkups. So I like to do periodic checkups, whether it be once a month, once every 2 months, once every 3 months. Again, I like to see a patient for as little visits as possible, but with them maintain the results as long as possible. It's really all about the individual patient and what's the best function for the patient. And also what their goals are. Some patients would come in and they just want to get rid of their back pain and leave. And some people want to work on improving their posture, improving their flexibility. It's really up to the patient that makes the decision.
So often I know my husband has gone to see a chiropractor, and a part of the therapy was he would say he's getting his back adjusted. Mm-hmm. And a lot of times what they did was applying a warm cloth and a popping noise he said he would hear. Talk to me about that. What's going on? What does this do? And explain all that.
Sure. So that cracking is what people will call it, is a chiropractic adjustment. So the chiropractors basically will look throughout the spine, and we will be able to look for vertebrae that are not moving properly or rotating. We call that subluxation, where it's kind of not moving properly or out of position. And with our hands, we are trained to realign the spine. And when we do that, you'll hear that cracking sound. And that's just a release of carbon dioxide from the joint. So I will tell you that chiropractic is the safest modality that's out there. And it's a really good way to potentially really be helpful to people.
Wow. So is this something that insurance will usually cover?
Yes, a lot of insurances cover chiropractic. Again, I just want to say how safe it is. We have the lowest malpractice rates. So malpractice rates determine the safety or the efficacy of the treatments. So chiropractic is the safest treatment plan. So I really would recommend someone who's suffering from back pain. A chiropractor is a very good person to start with if you're suffering from back pain and need some help with back pain.
So you talked about an approach with the diet, with the exercise, with the psychological, emotional approach. Yeah. How could I eat to better help my back problems or pain?
Yeah, so an interesting story was my father was a chiropractor for 15 years, and then one day he bent down to pick up a tennis ball, and his back went out. And he wound up being bedridden for 9 months where no one can help him. He went to chiropractors, physical therapists, and basically an orthopedist said they wanted to do exploratory surgery on him. So he certainly decided that wasn't a very good option. So he wound up seeing this doctor who came up with a very unique or interesting theory. So back in the 1970s, you could basically eat whatever you wanted as long as you were thin. So my dad's diet was based off with a lot of sugar. He'd have dessert after every meal, and he had a lot of sugar. And what happened was the sugar, or the doctor surmised that the sugar was upsetting his digestive system. And then the digestive system was reflexing, affecting the muscular system. And that was something called a viscerosomatic reaction, which is just a big term that just means that we are what we eat, and our foods affect our muscular system. So bodybuilders or weightlifters will know that if they want to be strong and healthy, they're going to have to eat a very healthy, clean diet. So for my father, the intake of sugar raised the inflammatory factors in the body and created these back spasms. So within about 2 weeks, my dad cut out his sugars, decreased the inflammation in his gut, which then removed the back spasms.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College student Gina Peter. And today we're learning about chiropractic care with our guest, Dr. Todd Sinett, a chiropractor and the founder of True Whole Care. That's True spelled T-R-U. Originally from Long Island, Dr. Todd Sinett is also a pain expert and author of several books. So I think Gina has a question for you now.
All right, Gina, bring it on.
So you're talking about the whole diet and everything. And I do hear that if you have a strong core, it gets rid of back pain. So how would a strong core get rid of back pain?
Sure. So it was very interesting, the term strong core. So I had been working with a patient of mine who happened to be an ESPN fitness model. And she had seen, I think, 26 doctors at the time, and she was looking for help because she was suffering from neck pain, mid-back pain, and lower back pain. And no one could figure out what her problem was. And I was just trying to figure out what was going on with her. And I asked her what she did for a living, and she was a fitness model. And she was the model on the TV shows that was doing all the sit-ups and the crunches. And what happened is that she'd been doing so many sit-ups and crunches that she altered her alignment and her posture because she created so much forward hunch from the sit-ups and the crunches. So actually in her case, or in most people's cases, our cores are actually too strong rather than too weak. So when I tell people that, they look at me like I'm a bit crazy. But if you look at a common posture for people, everyone is hunched forward. We're all looking down at our computers. We're all looking down at our smartphones. And we're all rounded and hunched forward. And what's happening is our core is being overcontracted, shortened, and tightened rather than stretched and elongated. So the argument is if everyone's core was too strong, we would all hunch forward, which is what we're seeing. And if the core was too weak, we'd be literally walking around as if we were doing a limbo. And that's not the case. So I developed a product called the Backbridge, and that's designed to decompress, elongate, and remove all that forward hunch called flexion in your body. So it's very, very important to have a balanced core, and that's simply something that we don't have in our society. So the reason why we're having so much back pain is all of our poor posture because our core is overcontracted, shortened, and tight. So I wrote a book called Syrups Are Stupid and Crunches Are Crap. And the first part of the book is explaining the theory behind why the sit-ups and crunches are so harmful and that no one should ever do them. And then the second part is really how to get the core and the abs the way that you want them to look. So it was a pretty fun project to do.
So if you were to describe a back bridge and give us an illustration of what this looks like.
Sure. So envision half of an exercise ball cut in half. So you basically be able to lie on it. It would be nice and stable. And then it would come in 5 different interlocking pieces. And again, what's happening is because we're so forward hunched, we need to basically lay back and we need to put extension into our body, doing something like a back bridge. So what this is you're able to lay on it. You can also put it behind you in a chair, but you lay back on it. And I recommend people do it 2 minutes in the morning and 2 minutes in the evening, and elongate or decompresses the spine. I call it Invisalign for the spine. And then as you improve and progress, you keep adding levels or layers that go higher and higher. So we continually to remove all that forward hunch from your body, get you standing tall and well aligned, and better posture leads to better function. So what it does is essentially can help get rid of your back pain.
I understand how that helps the back. How does that help in terms of strengthening your abs?
Well, again, what I said is that your abs most likely are more contracted, shortened, and tight rather than weak. So the first thing you want to do is you want to elongate, stretch, and expand the abdominal muscles. And then there's a whole bunch of core exercises in the book that will not put your body in that forward hunch. So any exercise that puts you in a curled or C pattern is an exercise that you should never be doing. So certain exercises are planks, leg raises, hip ups. There's 10 million different exercises, and I have them all in the book of which exercises I think are good core strengthening exercises for you. Dead bugs, exercises like that.
How about working out your back muscles?
Yes. So again, we want to balance between our front body and our back body. So again, you need proper alignment. So think of your core and your back like a tent. So if the core is pulling down too much, your tent's going to grow crooked and everything's going to go forward. And if your back is too strong, you're going to basically be bent back like you're in a limbo position. So yes, we want to work our extension muscles. We want to work our muscles in our back. So we want to do exercise such as Superman's. We want to do lat pull downs. You want to do pull-ups. You really want to focus on putting extension into your body, and working those muscles is a really important balance, or a really important way to get that balance.
So tell me, how has the COVID pandemic helped or hindered this whole back pain epidemic that we are experiencing and have been experiencing for years? Yeah. Has it helped or hurt?
Well, I think it's helped the epidemic of back pain. It hasn't. I think more people are suffering from back pain now than ever before. And simply because we're sitting in a lot of work situations. I mean, I have people in New York City who are working in their bathroom. So when they're not sitting at proper workstations and they're just sitting hunched in front of their computer, their laptops. So again, everyone's getting this forward posture that's magnified because we're not moving around in offices. We're not sitting in well-designed ergonomic desks that we would have at home, that we don't have at home. So we're seeing a lot more back pain. So just the simple sales of the Backbridge are telling us how important it is and how people are looking for a self-care solution so they can almost treat themselves.
Do you provide telehealth, meaning that can patients call and you do a diagnostic over the internet, Zoom or something?
I don't provide telehealth because chiropractic is so much based on a hands-on approach. Mm-hmm. I'm happy to speak with patients over the phone, but it's really more of a something that I'm happy to do. But there's a lot of great self-care. I think my books could be very, very helpful in a person help diagnosing their back pain and figuring out where their back pain is coming from. And there's lots of great self-tips. So there's a book called 3 Weeks to a Better Back, which is basically a self-diagnosis, self-help back pain sufferers book in conjunction with my Backbridge. It's remarkable what an individual can do on their own just by making some simple changes. Can you tell me again where your offices are located? Sure. My office is on 53rd and Madison Avenue in New York City. And again, it's called True, TRU, Whole Care. And my website is drsinett.com. And if anyone's interested in the Backbridge, it's backbridge.com. And is that in your office as well, the Backbridge? Yeah. You can get them in the office. You can get them on Amazon. You can get them on my website. It's pretty much available everywhere. Oh, wow.
How about your book? Sit-ups are stupid and crunches are crap. I like that book. Where do we go to get that?
Sit-ups are stupid, crunches crap is available on Amazon. It's also available at drsinett.com. I wrote a book called 3 Weeks to a Better Back, which is the self-diagnosis, self-help book. I also wrote a stretch book that goes along with the Backbridge called the Ultimate Backbridge Stretch Book. And then I wrote a standalone back pain relief diet book, and that's the direct correlation. It's a standalone book on the correlation between diet and back pain and what to do about it and how to fix it.
On your website bio, it says, fun fact, you used to get paid to dance at weddings. Can you tell us a little bit about that story real quick?
And the answer is no. I can't. What happened is my sister had gotten married a couple of weeks earlier, and I was, I guess, celebrating and enjoying the celebration of my sister getting married, and the person who managed or ran the place where she got married, they were looking for waiters who would dance and interact with guests to, I guess, raise the level of the party. Mm-hmm. So I was a waiter, and then I danced at weddings, which was, yes.
Wow, on the side. Wow.
There you go.
Can pregnant women see chiropractors?
Yes, pregnant women can see chiropractors. You want to seek out chiropractors that have experience in treating pregnant women. Again, chiropractic is the safest modality there is. A lot of pregnant women do suffer from back pain, so it's a very good modality that someone can use because pregnant women can't take a lot of medication, obviously, So it's certainly worth trying. And we've seen a lot of great success and relief for pregnant women with chiropractic care.
I have a random question.
Bring it.
Some bodybuilders, they can't turn their heads. Is that a rumor or is that true?
Yes. So it's very funny because if you ever look at a bodybuilder, they always have difficulty turning their heads. And one of the rationale is that their traps are so developed that their ability to turn their head gets in the way. And that's actually not true. That's not the reason why that happens. The reasons why it happens is because they're doing so many sit-ups and crunches that they're literally making their core so tight. Mm-hmm. It's as if their body's walking around with a straitjacket, and that's why they can't turn their head very far. But if you just have them raise their arms above your head, which will stretch or lengthen the abdominal muscle of the core, immediately their range of motion in their neck will dramatically improve. So it's because they're not working out properly. They're looking good, or their abs are looking good, but they're not having great function because, again, it's too much forward posture brought on by those harmful exercises such as sit-ups and crunches.
What is the one thing you want to leave our audience with when it comes down to your companies?
I want people to realize that back pain, just because a lot of misery has a lot of company, doesn't mean it's so. So there are answers out there for your back pain, but you need to approach it in the right way. You need to look at the structural aspects, you need to look at the digestive or dietary aspects, and you need to look at the stress aspects. And if you're seeking somebody who looks at all three, or you're doing it yourself, if you're looking at all three different causes and solutions of back pain, that's going to dramatically increase your chances of living a back pain-free life.
Amazing. So can you please give us your website one more time?
Sure. So my website is drsinett.com. That's SINETT.com, or backbridge.com if anyone's interested in the Backbridge.
Well, thank you for being here, Dr. Todd Sinett, a chiropractor and the founder of True Whole Care. That's True, spelled TRU. We hope you stay safe and continue the great work. And thank you for being our guest today.
Thank you so much.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.